I'm Dr. Judson Brandeis, urologist and expert in sexual medicine. I want to talk with you about new developments with COVID-19 that relate to sexual health. A 48-year-old patient came to my San Ramon office who had fully recovered from a coronavirus infection, but was experiencing a new onset of erectile dysfunction. I started looking at the literature, and now I'm concerned that the COVID-19 pandemic will result in widespread erectile dysfunction. And let me explain why. Erectile function is highly dependent on pressurized blood flow, which starts at the heart and pulses through the large arteries and then flows through small blood vessels. Conditions like diabetes, high cholesterol, and smoking cause damage to the inner lining of blood vessels, which result in erectile dysfunction. Guess what else causes damage to the inner lining of blood vessels? COVID-19. In order to understand why COVID causes erectile dysfunction, you must understand what's happening at the cellular level when someone is severely infected by coronavirus. As the infection mounts, there's an epic battle going on. Just like the 9/11 terrorists used our own airplanes to take down the Twin Towers, the coronavirus hijacks our own cells to create new viruses, which are then released in huge numbers. Our immune system has never seen this virus before, so we don't have antibodies to COVID that would make our immune response selective and targeted. Instead, we must attack COVID with a massive, non-specific immune response. Our white blood cells furiously assault the virus, gobbling up particles and pouring out chemicals in a feverish attempt to stamp out the invader, which in the meantime is replicating at a frightening speed. The intense assault against the virus causes massive collateral damage to our own body, particularly the delicate microscopic cells that line our smallest blood vessels, the endothelium. They are especially vulnerable to this type of destruction. But there's a second story here. Risk to the protective lining of the endothelium called the glycocalyx. Referred to as a brush barrier, the glycocalyx shields the endothelial cells from damage and prevents blood clots from forming. The immune system vigorously attacks COVID, but this inflammation can damage the glycocalyx, resulting in the loss of protection of the endothelial cell. Destruction of the glycocalyx results in turbulent blood flow that can damage the endothelium, allowing fluid to leak outside of the bloodstream. Just imagine bulky blood cells and jagged proteins banging into the exposed cell membranes. The endothelial cells control the width of blood vessels by releasing nitric oxide, which determines how much blood gets through. The endothelium also releases factors that narrow blood vessels, which increase blood pressure but decreases blood delivery to peripheral blood vessels like the blood vessels to the penis and the toes. When arteries narrow and are stripped of the protective glycocalyx, clots can form that block blood flow entirely. The coronavirus could cause erectile dysfunction in 4 different ways. First, direct damage to microstructures like the glycocalyx due to massive inflammation causing friction to blood flow. Second, formation of blood clots that clog critical small arteries entirely. Third, narrowing of blood vessels due to damage to endothelial cells. And fourth, COVID can dramatically affect the heart and reduce the delivery of blood flow. In conjunction with these effects on the circulatory system, COVID is also known to cause strokes, heart attacks, blood clots in the lungs, COVID toes, and kidney damage. So how can you protect your endothelium and reduce your risk of developing erectile dysfunction from COVID? Nitric oxide is emerging as an early treatment to protect older patients who have lower levels of nitric oxide due to age and underlying illness. An article published in the Nitric Oxide Scientific Journal in July highlighted multiple ways nitric oxide could protect against severe COVID infection and protect blood vessels. There are multiple ongoing trials using inhaled nitric oxide as treatment, including a remarkable study at the Massachusetts General Hospital on pregnant women with severe COVID infection that showed dramatic improvement. For hospitalized patients, inhaled nitric oxide is an appropriate option. However, for men and women over 50 in the community, supplementing nitric oxide with a citrulline-based nitric oxide booster is a possible way to prevent the development of severe COVID infection. There are several citrulline-based supplements on the market. I developed Affirm to help men with erectile issues, but based on what I now know about how COVID attacks blood vessels, I believe that it can potentially reduce the effects of COVID infection on blood vessels. There's certainly more research that needs to be done. I think the important thing to keep in mind is that until you are vaccinated and have developed anti-COVID antibodies, it's important to protect yourself against infection by wearing a mask and avoiding social gatherings. COVID can hurt you in so many ways. Now add erectile dysfunction to the list. Nitric oxide has the potential to protect you against severe infection, but like many COVID interventions, it's too early to be certain. Just as an aside, I received the Pfizer vaccine as a clinical trial participant 2 months ago. I had no side effects other than a sore shoulder for 2 days, and my antibody titer shows that I'm immune. Based on my experience, I recommend vaccination to all of my family and friends. This is Dr. Judson Brandeis from BrandeisMD and Affirm Science. Thank you for listening, and please like this video and share it with your family and friends. Stay healthy and safe.